Okay, picture this. It can happen to literally anyone. You're just walking outside, minding your own business, and you hear it, that tiny, faint cry. You look down and there it is, a newborn kitten, completely alone. What you do in the next 48 hours is absolutely, without a doubt, critical. So let's dive into this quick guide that could actually help you save a life.
You know, a kitten this young is one of the most fragile little things on the entire planet. I mean, they can't see, they can't keep themselves warm. They are 100% dependent on someone else for everything. Those first few hours, it is a race against the clock. The stakes could not be higher, because your immediate actions are what will make or break its chance of survival.
So the single biggest danger for a newborn kitten is a condition that can strike with terrifying speed. People in the rescue world call it the silent threat, for a reason. A kitten can seem perfectly fine one minute and then just decline rapidly. It's called Fading Kitten Syndrome, and you absolutely need to know how to spot it.
Now, it's really important to get this straight. Fading Kitten Syndrome isn't like one specific disease you can pinpoint. Think of it more like a collection of symptoms. It's a giant flashing red light that tells you the kitten is in critical distress. It is a true life-threatening emergency, and just being able to recognize it is your first step in fighting back.
So what are you actually looking for? Well, a constant, high-pitched crying is a huge distress signal. If the kitten feels cool or cold to the touch, that's a big problem. Watch for it separating itself from its litter mates, if there are any. Is it not gaining weight? Or worse, losing it? Is it struggling to nurse? These are all urgent warning signs. And pale or bluish gums, that is a drop everything and act now emergency.
All right, so you've spotted the signs, the kitten's in crisis. What now? First, don't panic. We're going to focus on something I like to call the kitten survival trinity. 3 absolutely critical things you have to do right away. Think of it like this: warmth, stimulation, and nutrition. Let's break it down.
Okay, first things first, and this is non-negotiable: warmth. Before you even think about food, you have to get the kitten warm. See, a chilled kitten literally can't digest food properly, so trying to feed it is useless at best and dangerous at worst. A heating pad set to the lowest setting and wrapped in a couple of towels is perfect. Just make sure there's enough room for the kitten to crawl away from the heat if it gets too warm.
This next one might sound a little strange, but trust me, it's absolutely vital. A mother cat would normally lick her kittens to get them to go to the bathroom. Without her, guess what? You're on duty. After every single feeding, you need to take a warm, damp cotton ball or a soft cloth and just gently rub their genital area. This isn't optional, it's a must-do for them to survive. All right, once the kitten is warm, it's time for food. But, and this is a big but, not just any food. Let me be crystal clear here. Never, ever give a kitten cow's milk. Their little systems just can't handle it. You need to get a commercial kitten milk replacer, often called KMR, from a pet supply store. And get ready, because they need to be fed every 2 to 3 hours, around the clock. Yep, that means setting middle-of-the-night alarms.
So we know what to feed them, but the next critical piece of this whole puzzle is the amount. It is incredibly easy to overfeed a tiny kitten, and believe it or not, the consequences can be just as deadly as underfeeding.
I really want you to wrap your hat around this. A brand new kitten's stomach is about the size of a small marble. It is unbelievably tiny. And that's not just a fun fact. It's a critical piece of info that dictates exactly how you feed them and why being precise is so important. And here is the math that can save a life. A kitten can safely handle about 4 milliliters of formula for every 100 grams of its body weight. 4! That is such a tiny amount. If you go over that, the formula can actually go up and into the lungs. That's called aspiration, and it is very often fatal.
This chart right here just illustrates the point perfectly. I mean, look at that first week. A kitten that weighs just 4 ounces only needs about 5 milliliters per feeding. You know how much that is? 1 teaspoon. That's it. As you can see, the amount goes up as they get bigger, but it starts so incredibly small. This chart needs to be your best friend. Follow it, and if you're ever in doubt, it's always better to feed a little less than a little too much. Okay, you've provided warmth, you've helped them go to the bathroom, you've given them exactly the right amount of the right formula. You have done an amazing job as a first responder. But, and this is a really big but, your job as the first responder is over. It is time to call in the professionals. So, the most crucial point, the single most important takeaway from this entire thing, is right here in this quote: head to a veterinarian as soon as possible. Everything we've talked about, these are stabilization techniques. They are meant to give the kitten a fighting chance on the way to the vet. They are not,
And I repeat, not a substitute for a real doctor. A vet can spot infections, dehydration, or birth defects that you would never be able to see. So there you have it. Warmth, stimulation, the right food in the right amount, and an immediate trip to the vet. That's the playbook. It's intense, it's incredibly demanding, but knowing these steps means you're prepared. So the next time you hear that tiny, helpless cry, you won't just feel bad for it. You'll have the knowledge to step up and be a hero. The only question is, are you ready?